reaching out to partners in the private sector, hospital labs, and research institutions to try to get the ingredients needed to run these tests. We are working with our partners at the state lab and our federal partners to ensure that they can continue to run testing as other labs around the state continue to work to come online to help meet demand. Dr. Bateman from the state lab will provide additional details in his remarks. Additionally, as we talked about yesterday in our media briefing, we have evidence of community spread here in Wisconsin. Specifically, we have evidence of community spread in Milwaukee, Dane, and Kenosha counties. This means that there are people who have tested positive and have no exposures to a known case or did not travel to a location where there is known community transmission. Due to these two factors, community spread and our testing challenges, the governor has directed me to sign an order for a statewide moratorium on mass gatherings of 10 or more people to mitigate the spread of COVID-19, effective today at 5 p.m. The governor will talk more about this in his remarks. As we discussed yesterday, we must protect and ensure the capacity of our healthcare system. The steps we are taking today, prioritizing testing and enacting stronger social distancing, are necessary steps to do this. We know this will further disrupt your lives, but this is necessary to further stop the spread of COVID-19 and to protect the capacity of our healthcare system. Now is the time to make a plan to stay home. It is vital for everyone, but especially for people who are at high risk and vulnerable, like our older citizens and those with compromised immune systems. These are the people who have been most adversely affected by COVID-19, and these are the people and the reasons that we all need to take these actions and these recommendations very seriously. Please know the signs and symptoms of COVID-19. These include fever, cough, and shortness of breath. And these are important symptoms to understand when we talk about the prioritization of testing moving forward. If you have these symptoms, call your healthcare provider before you go to a clinic or a hospital. Calling first will further help us preserve the capacity of our healthcare system. I can't say thank you enough to our local and tribal officers who are our boots on the ground in dealing with this public health crisis. The steps we are taking are an unprecedented adjustment to your lives, your businesses, and your activities, but we need to do this to help mitigate the spread of COVID-19. Your efforts are appreciated. We will get through this. The governor and DHS will continue to provide timely and factual information as long as this health crisis continues. Thank you so much. I'll now turn it over to the governor.
Thanks a lot, Andrea, for your good work, and good afternoon, and thank you all for joining us once again today. Obviously, it's St. Patrick's Day. We know this is a day many Wisconsinites like to celebrate, and while it's different this year, enjoy the day with your health and safety and the health and safety of the community in mind. With that said, I want to talk a little bit about the state's new directives around social distancing today, as well as an update on some of the other measures the state has taken to help the people of Wisconsin. As Secretary Paul mentioned, I directed her to order a statewide moratorium on mass gatherings of 10 people or more to slow the spread of COVID-19. This order does make exceptions for some critical functions, including transportation, childcare, hotel, military, law enforcement, food pantries, hospitals, long-term care facilities, utility facilities, job centers, and courts. In addition, as of 5 p.m. today, all bars will be closed in the state and restaurants will be closed except for takeout and delivery. We are seeing community spread of COVID-19 in Wisconsin. This means that there are people who have tested positive who have had no exposures to a known case, nor did they travel to a location where there is known community spread. Today we have cases in Milwaukee, Dane, and Kenosha counties indicating that there is community spread happening in Wisconsin. Social distancing will help keep you and your family and our community from increased risk of exposure. What we're saying here, folks, is simply this: stay home if you can. There are workers on the front line who can't stay home. We need our healthcare workers, our direct care workers, first responders, military and service workers to stay healthy so that they continue to keep us all safe. We also will be expanding the school closure order until further notice. Now, beyond the health concerns, we know that the outbreak of COVID-19 is causing considerable uncertainty for workers and businesses, not only in Wisconsin, but obviously across the globe. To help our workers, we are asking the state legislature to immediately take up legislation to repeal Wisconsin's 1-week waiting period for unemployment compensation insurance. In addition, I'll be talking tomorrow with leaders of the legislature about a legislative package. In addition, tomorrow we will issue an order that will waive work search requirements and modify the availability requirements for unemployment insurance benefits for workers impacted by COVID-19. It's incredibly important that the much-needed unemployment insurance funds make it to affected workers quickly. This order will also waive the requirement that UI claimants who are impacted due to COVID-19 conduct at least 4 weekly work search actions. This ensures that claimants who are otherwise eligible but out of work due to COVID-19 are considered available for work and therefore available for benefits. This is in line with federal guidelines related to administering unemployment insurance benefits during the pandemic period and allows the program to support our workers who have been affected by COVID-19 outbreak. I have also called upon the Wisconsin Economic Development Corporation to work closely with Wisconsin Emergency Management and the U.S. Small Business Administration to unlock federal relief funds. The SBA is offering designated states and territories low interest, federal disaster loans for working capital to small businesses suffering substantial economic injury as a result of COVID-19. SBA's economic injury disaster loans offer up to $2 million per business in assistance and can provide vital economic support to small businesses to help overcome the temporary loss of revenue they're experiencing. Once the loan funding is unlocked, Wisconsin businesses will be able to access an online portal to apply for the economic injury disaster loans. Wisconsin Economic Development Corporation is also working to provide state-level assistance for local small businesses in the very near future. We also have important elections coming up, and it's imperative that our democracy continues. The good news is that Wisconsin makes it easy to request an absentee ballot. In fact, as of this morning, there are 500,000 absentee ballot requests pending. To help facilitate this influx of requests, I have directed state agencies to support the Wisconsin Election Commission in any way that they can. Finally, I want to talk to you about more ways that you can help and be good neighbors to one another. If you can keep your kids at home with you, please do so to ensure that child care is available to our frontline workers. Continue to wash your hands, clean surfaces, and cover your coughs and sneezes. Donate blood if you're able, and consider donations to food pantries and nonprofits to help folks in need. And right now, our supply chain at grocery stores is keeping up. But if folks continue to stockpile, then we will not be able to keep the shelves stocked. So the message is this: buy what you need, don't buy for a year's supply. So thank you very much for being part of this again today, and I'll turn it over to Dr. Westergaard.
Right. So I'm Dr. Bateman from the Wisconsin State Lab of Hygiene. I'll provide just a couple more details on the lab testing details. So we initially had a capacity of about 100 specimens that we could test a day, which was our normal capacity. We've since scaled up to be up to about 400 specimens per day. We've achieved this by extending hours of testing, and we plan to be testing for 7 days per week for the foreseeable future. This is our enhanced sustained capacity at this point of 400 a day. However, yesterday and today, the number of specimens that we've received has been substantially higher than this 400 mark. The PCR test that we use, that is the test that was developed at CDC, requires many different ingredients to produce a result. It's much more complex than a pregnancy test where one stick equals one result. So we have a decent number of supplies currently, but the supply chain right now is fragile because so many other labs nationwide are bringing on and scaling up this testing. This is a nationwide issue, not just Wisconsin. So to avoid depleting the supplies we currently have, we're working with our partners at DHS to prioritize the available tests. We've also been in daily contact with Wisconsin clinical laboratories located in hospitals to help them bring up testing in their own labs to increase statewide testing capacity. We've been contacting many supply manufacturers, are looking into additional manufacturers to further increase diversify our supply chain and increase our capacity. And we've also been in routine contact with the Association of Public Health Laboratories, which represents public health labs nationwide. We know that there is some frustration about testing issues nationwide. I do want to assure you that everyone at the state lab and our staff are working very long hours every day with our partners at DHS and others to do the best we can to serve the people of Wisconsin. Thank you.
Okay, thank you. And now we'll open it up to questions. A reminder to maintain quality audio, keep your phones on mute until it's time to ask your questions. If you can, use *6 to mute and unmute your phones. And we'll begin our questions this afternoon with Maddie Heim from the USA Today Network. Maddie?
Hi, thanks for taking the question. So I guess my first question would be, now that community spread is confirmed, what does that change in your approach, and what should it change in the public's approach of handling the virus, and how much easier now is it to sort of contract the virus in the places where community spread is happening?
Sure, this is Ryan Westergaard. I'll be happy to take that question. In important ways, our response remains unchanged, and in other ways that it has. The ways that it is unchanged is that we're continuing to investigate individual cases, do interviews in order to identify people who have maybe been exposed through contacts, and giving standard recommendations for social distancing and isolation and quarantine. We're continuing to do those things even now that we know that there's widespread transmission in the communities, because those are the ways that we prevent onward spread, is by giving people specifically known to have COVID-19 instructions on how to protect people around them. The things that have definitely changed about our response are the things that the governor and the secretary have been talking about. So these are the community-wide interventions that reduce in overall social distancing. What we've learned about the virus is that people can be quite contagious in the period before they develop symptoms. So because people can be asymptomatic and spread the virus, we need to make sure that in general, during this period where the virus is starting to spread, people keep distance between themselves. So that's really now the focus of our public health response. But we're not stopping to do the traditional time-tested public health activities of case investigation, quarantine, and isolation.
Okay, great. And then, so, I know that other states, like Ohio and Indiana, have released estimations of how many people throughout the state they think might have the virus just because of community spread. I know some of those numbers are like 10,000, 100,000 possible cases, even if those cases aren't confirmed. And I was just wondering if you are ready to offer that estimate yet for Wisconsin.
We're not at this time. At this time, we're still focusing on individual cases and individual response in partnership with local health departments and healthcare partners.
Thank you, Maddie.
Okay, thank you.
To Mike Kemeter from WHBY. And a reminder, *6 to mute and unmute your phones. Mike Kemeter from WHBY Radio. And we'll move on to Austin Montgomery from the Beloit Daily News. Austin?
Hello. I'd like to direct my question to Dr. Bateman. Just specifically, if you could speak on the ratio of total test kits available to possible percentage of defective kits or kits that don't have the reagents needed to do the proper testing. Thank you.
I'll try to answer your question. So the many different ingredients that go into our test, it's a bit akin to baking cookies, so you need many different ingredients for that, and if you don't have one particular ingredient, then you can't, then we can't produce those results. So we're actively, and it's a day-by-day, hourly sort of thing as we order many of the supplies and reagents that we need, and we do additional testing that it's an always evolving number of how many tests we still are able to do. Does that answer your question?
Yes, relatively. Just a ballpark figure, how many tests are available right now in the state?
I can say at the state lab, we're definitely not going to run out tomorrow or the next day, but the supplies that we do have are not unlimited, which is why we need to work with our partners to do this prioritization of testing.
Thank you.
Thank you.
Thank you. Charlie Presser from the Crawford County Independent. Charlie? And a reminder, *6 to mute and unmute your phones. Charlie Presser from the Crawford County Independent. And with that, we'll move on to Brian Herman from WLUK in Green Bay. Brian? Brian from WLUK. Okay, we'll move on to Sarah Thompson from WBAY in Green Bay. Sarah?
Hello, thanks for taking my question. For the governor, you mentioned something about expanding the school closure notice until further notice. What did you mean by that, or could you elaborate on that?
Yes, in the first notice, executive order around this issue, we had an April 6th deadline. We're removing that deadline just because we don't know if it's a realistic deadline. So we're making it indefinite. We're going to continue to monitor this on a regular basis and open up schools as soon as possible, but it certainly won't be before April 6th. So we made it indefinite.
Follow-up, Sarah?
So there is not an end date for that now?
That is correct.
Okay, thank you.
Thank you. Now to Addie Bink from WFRB in Green Bay. Addie? A reminder once again, *6 to mute and unmute your phones. Addie from WFRB in Green Bay. Moving on to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Well, thanks for taking my question. One quick thing. Can we get the counties that the new cases are in? And then as a secondary question, this one is for the governor. The moratorium on gatherings of more than 10, will that be enforced by police? And if so, will there be, what would the penalties for that be?
This is Ryan Nelson, Student Governor Evers, Chief Legal Counsel. In terms of penalties, that is enforced by local officials, local law enforcement. Failure to file or comply with a health order can result in a $250 fine and or imprisonment up to 30 days. That said, we do expect people to comply with this. It is a serious situation. And we hope that Wisconsinites do what they always do and chip in and do their part to combat COVID-19.
Fantastic, thank you. And can somebody speak to the new cases?
So as for the number of counties in which we have cases, unfortunately that's been changing on an hour-to-hour basis. So we have updated our website daily, which you can see the number of cases that have been identified every county, and that we freeze those data and present them at 2 o'clock on the website.
Thank you,
Are there
Rob.
any new counties?
I don't have the list in front of me, so it'll come online at the update at 2 o'clock.
Thank you.
Thank you, Rob. To John Nizer from NBC 26 in Green Bay. John? And a reminder, *6.
Can you hear me?
Hi, John.
Yes.
Yes.
All right, Governor, do you anticipate the National Guard will be called up for state active duty, and if so, what role will they play?
The National Guard has been very cooperative with us right along. They are part of our team that's rolling out these emergency procedures. They did activate several National Guard members to bring back from Georgia, folks that were on the the cruise ship that's sat in the Pacific Ocean for many days. And they did a great job there. They are ready and willing to help in any way possible. And the new adjutant general is working with us every single day. So if there's a need to call more up, we will. And they have been very, very helpful.
Okay, and then you mentioned those cruise ship passengers. We've been told, of course, that none of those individuals have tested positive. All were asymptomatic, and they're all doing self-quarantine. But were they all tested for COVID?
I believe the answer is yes.
No, our policy for returning travelers is that tests are only indicated for people who have developed symptoms. So the most important thing in a returning traveler is a symptom evaluation and an interview. And people only get tested if they develop symptoms.
Thank you.
Thank you, Jim. To Tiffany Olson from WKBT in La Crosse. Tiffany? Tiffany Olson from WKBT. We'll move on to David Wahlberg from the Wisconsin State Journal. David?
Yeah, hi, thank you. It looks like more drive-through testing is becoming available in Wisconsin. So I'm wondering, can you characterize the extent of drive-through testing that you're aware of? And then given that drive-through testing likely is going to create more testing demand, and yet at the same time you're saying only certain people should be tested, how are you going to square those two things?
I'd be happy to start by addressing that question and talk more about what we mean when we say we're prioritizing tests and how we hope that gets implemented. So the availability of drive-through testing is something that we support in order to reduce the threshold for getting people tested. But our message to clinicians that went out today, and I think it's also important for the general public to hear and understand this message, is that not everyone needs a test. People that don't have any symptoms have no reason to get a COVID-19 test. And people who have minimal symptoms like the common cold also likely don't need a test. So why is that? So understanding who has COVID-19 is very important for people in the hospital because that allows us to help make appropriate diagnosis and management decisions and also helps us do maximum interventions related to infection control. For people who have mild illnesses, because there's not a specific treatment, it doesn't help us take care of people any better. In fact, most people get better without treatment. So right at this stage where our priorities are to minimize the spread in healthcare settings, and our advice to the general population is to stop the spread of respiratory viruses. We can control the infection, control the epidemic without knowing and being able to identify every single case. So the message to providers is that we really want to prioritize hospitalized patients who are high risk of having poor outcomes because of medical complications and comorbidities, and people in congregate settings like long-term care facilities. The message to the general public is that if you're not in one of those high-risk groups, you probably don't need a test.
Okay, thank you. And just as a follow-up, could someone characterize the aggregate level of ventilators that we have in isolation beds statewide and what the potential need might be?
So our folks in the statewide response are working very closely with our hospital partners around the state to do that kind of inventory, to understand how hospitals are thinking about the surge capacity within their own hospitals and across their communities, so that we have a good understanding of the status and the state of our ability to surge moving forward.
Are you saying you don't know the statewide totals yet, though?
So we are continuing to work to get a definitive number of ventilators.
Okay, thank you.
Thank you, David. Also from the Wisconsin State Journal, Mitchell Schmidt. Mitchell?
Yeah, thank you very much for the time today. I was just curious, as we start to look at state funding to address some of the needs, how much of an issue is the economy kind of downturn going to be? So it seems like all signs are pointing to the surplus being quite a bit lower than what we had projected back in January.
That's a great question, and obviously, we will take into consideration that possibility that the surplus that we do anticipate is less. But we're going to be working, as I mentioned before, having a phone conversation with legislative leaders tomorrow to talk about what sort of package might be considered. And one of those considerations will be what we believe the surplus to be. We'll be using all the data that we have at hand and making sure that we do a good job in making sure that people are not harmed by this. Obviously, there is some harm now, but we want to make sure that people and our businesses in the state are held harmless. Of course, the federal government will play a large role in that, and I know that they're looking at passing some legislation in the very near future.
Thank you, Mitchell.
Is there any sort of a price estimate at this point? I mean, I'm guessing that's probably hard to say.
I'm sorry, did you say is there a crisis at this point in time?
Or, excuse me, like a cost estimate at this point of kind of addressing?
Not yet, but we're working on that. Actually, ever since we started understanding the importance of this, we've been working on that, and we hope to have that information available.
Thank you, Mitchell.
Thank you.
To Tabitha Wuthel from WISC News 3 in Madison. Tabitha? Need a reminder again, *6 to mute and unmute your phones. WISC in Madison. Okay, we'll move on to Anita Weir from the Northside News in Madison. Anita?
Hello. My question is regarding potential hospital space if the current hospitals get full. Have you found closed hospitals or motels closed that could be used? Is there excess capacity? Also, what about the VA hospital? Is that being used, and will it be?
So this relates to the question earlier about surge capacity, and we are very actively engaged with the hospitals around the state to understand how they are thinking about their current bricks and mortar and what that means for surge, as well as what our opportunities are for closed hospitals, like you mentioned, or other infrastructure that we have that could be repurposed. That is very actively ongoing, and we'll continue to figure that out here.
So, but there's no list, there's no analysis of what is out there.
That's the conversation we are having right now.
Thank you, Anita.
Thank you.
To Charlie Pittman from WORT in Madison. WORT. And we'll move on to WKOW in Madison. WKOW?
Yes, thank you. I just wanted to clarify, you guys talked about it a little bit, but we get so many questions from viewers who call to get a test because they think they fit the criteria and the doctor doesn't end up testing them. So I just want to make sure, even though with the community spread here in Dane County and others, that nothing has really changed as far as criteria for having a test done. That the doctor would kind of have discretion over whether to choose to have somebody tested. Is that still the case?
Yeah, it's still the case that we're relying on healthcare providers to make that determination of whether someone needs a test. But we are giving specific guidance on who we think should be prioritized for testing. And as I said, that's people who are severely ill and require hospitalization. So that does mean that people who do not require hospitalization, or people that have mild respiratory symptoms for which they wouldn't normally go to the doctor. Many times we get a cold and we go to the pharmacy and get over-the-counter medications. We actually want those patients to not go get tested, even assuming that some of them have COVID-19. And the reason for this is because as it spreads in the community, we want to do everything we can to reduce the strain on the healthcare system. And so for the most people who develop this infection are going to be fine. It's going to be just like the common cold. It's going to get better with supportive care. There's not a high need to get tests for those people. In fact, it's actually protective of our healthcare system and our healthcare workers to keep them at home and make sure that they have resources they can call if they have questions or if they're concerned about their symptoms. But in general, we want people to feel comfortable that if you have any respiratory symptom, whether it's COVID-19 or influenza, which is still going around, or another one, if your symptoms are mild and you don't have medical complications or chronic diseases that put you in a high-risk category, you don't necessarily need a test. And so that's our recommendation for both patients and providers right now.
Okay, thank you. That's my understanding. I just wanted to make sure. I know you guys had chatted about it before, but my other question is, can you be more specific on the the communities, towns, and cities that have this? I know you send out the counties, but we get a lot of questions about which areas of the county, and for like Milwaukee and Dane, it's a little bit bigger.
So no, our decision sort of for all of reportable diseases that we do in public health is to report no less than the county level, unless there's a specific exposure or a specific facility, for example, that we think poses a risk to the public. If the public needs to know about a specific area that would be unsafe to visit, then we tell them that. But just to protect privacy of individuals, we only report data out at the county level.
Okay, thanks for taking my question.
To Taylor Hott from Fox 6 in Milwaukee. Taylor? Reminder, star 6.
Good afternoon. Thank you for taking my call. First of all, when it comes to the Wisconsin Work Share program, which EWD has already been encouraging people to register with, is there a cap or a dollar amount of folks that you'll be able to help with that fund?
We'll have to get that information for you, unless you know.
DWD is actively working in order to build up capacity and be able to address the increased need. That's something that we've been actively working on.
Okay. And my follow-up question is, if I'm hearing you right, even if you may have COVID-19, don't go get a test because you can, stay at home. Is that an indication that we will never have an accurate number of the amount of people here in Wisconsin that actually have it?
I believe it's fair to say that we don't intend to count every single case, but that doesn't mean that we can have an accurate assessment or estimation of the numbers of cases or the degree of the epidemic. We do something very similar with influenza. We do surveillance, which means we count hospitalizations, and a certain proportion of people who come into healthcare get a test just for data collection purposes. So we, in epidemiology, feel that we can give a good estimation of the disease burden in an area without counting every single case, and that's something that we do for all conditions.
Thank you, Taylor. Two reporters from WISN in Milwaukee, Andy or Matthew? From WISN.
Hello, can you hear me?
Yes, we can.
Can you hear me? I'm sorry.
Yep.
Okay, so help me out here, Dr. Westergaard. So, the only way to contain this, if everyone gets a test, for example, if you have symptoms that are mild and you stay home for 2 weeks, how do you know when you're not infectious to other people again?
Yeah, that's a great question. It's still a new virus, and the research is ongoing, but there have been some publications from various parts of the world that have shed some light on this. We feel that a majority of cases, about a week to 10 days after the onset of symptoms, the level of virus that's they're shedding or that's coming from their body is low enough that it makes transmission unlikely. So it may not be 100% that we can tell everyone without some very sophisticated testing when they're not contagious. But as a general recommendation, people whose symptoms are completely better, they've had no fever for 3 days, and at least a week has gone by since they started to have symptoms, that's the threshold that CDC and we are adopting as a good recommendation for when someone's no longer contagious. So that's something that's really been an evolution. A week ago, we gave guidance to our local public health that we thought 2 weeks was the safest. But some international public health organizations, based on some research, have said that a 7-day period is probably sufficient as long as their symptoms have gotten better and they've had no fever for 3 days.
Okay, follow-up, quickly, Wisen?
That's it, I'll give my time away, thank you.
All right, thank you. To Mark Stevens from CBS 58. Mark?
Yes, we were originally being shown data that was a positive recovered. That's no longer there. Is that data still being collected?
We have one positive case that is recovered in the state of Wisconsin. That number is the same.
Okay, so no additional cases like that.
Correct.
Thank you.
Thank you. Molly Beck from the Milwaukee Journal Sentinel. Molly?
Hi, thanks for this call. This question is for the governor. I'm wondering what kind of guidance you're giving to local officials for enforcement of the bar and restaurant closures and the gathering limits. One county sheriff told us they're just responding to complaints and are not going to be proactive about it. I'm just wondering if you think that's adequate.
Molly, this is Ryan Elsestuen. The Attorney General will be providing guidance to local officials regarding enforcement. And again, this is something where, while there are penalties associated with it, we really do hope that everybody chips in and does their part because of the gravity of the situation and the number of businesses and places impacted by this order.
Molly? To Patrick Marley, also from the Milwaukee Journal Sentinel. Patrick? Patrick Marley, Journal Sentinel. And we'll move on to Lauren Anderson from the...
Yes, I'm sorry.
Oh, hi, is this Patrick?
Right. Yeah, sorry, I had trouble unmuting my phone there. You earlier stated that we won't run out of these reagents or supplies tomorrow or the next day, but what about the day after that? When do we hit the wall on your supply chain that will make it so you can do tests?
So that's exactly what we're trying to prevent with prioritizing the samples, the reagents that we have for the highest priority specimens. And it's a constantly evolving number as we do more tests as well as order more supplies and ingredients for it. So I can't really give you an exact, it won't be the day after that, I can guarantee that. But just the general, we know that these are not unlimited, and so we need to prioritize the testing capacity that we do have.
I would say, Patrick, this is Andrea Palm. We also are working very actively with other labs that are coming on board and in the private sector and other partners to help us expand capacity and bridge this so that we are spreading more widely folks who are able to do this testing to take some of this pressure off the state lab as well. But expanding capacity more broadly is a really important part of the sustainability of our testing capacity over time.
And thanks so much for that. Switching topics a little bit, ICU beds, do you feel that you have a good handle of how many ICU beds there are in the state, and will it be enough for what's going to hit us?
So I think the actions that the governor's directed me to take today and the ones since Thursday when we declared the public health emergency are all designed to try to protect the healthcare system so that we do have the capacity and that we are able to surge to a place that we are able to treat those who are most severely impacted by the disease. The planning that is going on simultaneous to that is assessing that surge capacity, is understanding beds and where they are and how folks are going to be working together to utilize that capacity so that as this evolves and continues to evolve and we take further actions, that those systems are ready and in place when we need that surge.
And so do you know how many beds we have?
Well, it's not a static number because facilities will convert space. They will places that are ambulatory or that have lower priority patients that are not part of this response, they'll take over those parts. There's all of that planning and everybody thinking through their own capacity within their own facilities is happening now. And so we will get a better understanding of the full capacity of the state of Wisconsin as the hospitals continue to think through that, and we all work together to get to a number that everybody has an understanding of.
Thank you, Patrick. Moving on to Lauren Anderson from Biz Times in Milwaukee. Lauren?
Hi, thanks. My question is, of the 72 cases that are confirmed at this point, what do we know about those patients' status? Are they, how many are being hospitalized in critical care, and how many are recovering at home?
We don't have that. We don't have the information to share with that level of detail. Many of the cases were just identified today, and we're still collecting information.
Follow up, Lauren? Okay, we'll move on then to Chuck Korbach from Milwaukee Public Radio. Chuck?
You are unmuted.
Hi there. Could you still talk about the age range, and specifically, do we have any people 18 and under who are ill?
Again, we don't have that information at that level of detail right now.
Thank you, Chuck. Jeremy Janine from Urban Milwaukee. Jeremy?
Question on what happens if they were to run out of testing supplies. Are there other types of tests that can be administered? Do you just treat cases based on what evidence is at hand? What happens?
So as we mentioned earlier, there's no specific treatment for this particular infection. The reasons that it's helpful to know are so we can provide the best supportive care and not provide unnecessary treatment for other things like influenza. So in the absence of proving a diagnosis, when it comes to how we treat individual patients with diseases, it doesn't change that much. We support their breathing, their oxygen levels, and provide all the supportive care that they need. If there's uncertainty about whether someone has COVID-19, and this is very often the case because tests don't come back immediately, so if a patient is suspected, we do the maximum infection control precautions. We keep people we use personal protective equipment and masks to prevent the spread. So in those periods where we don't have a diagnosis confirmed, we err on the side of caution and use full protective equipment. And the role of testing is really to confirm so we understand how big the epidemic is and also understand the risk of spreading to other patients and healthcare workers.
And just to add to that, we are doing a lot of the testing for the state, but we're not the only lab in the state. There are, the Milwaukee City lab can also do this test, as well as 2 clinical labs in hospitals currently, and there will be additional large clinical labs coming online in the next 1 to 2 weeks. So statewide testing capacity will continue to increase.
Thank you. Thank you. Zach White from WJFW in Rhinelander. Zach? WJFW in Rhinelander. And reminder, star 6 to mute and unmute your phones. We'll move on then to Matt Piper from the Sheboygan Press. Matt?
Yeah, thank you. I'm sorry if this was addressed earlier, but I am wondering, with the amount of tests that you're saying you have the capacity to do each day, over the weekend, if I understand right, you could do 300 per day, now you can do 400 per day, and you have more requests coming in than that. Why are the daily numbers of new tests not 300 or 400, considering that's just the one lab that those tests are occurring at, and there are other labs contributing as well?
So the number of tests that are performed in a lab aren't necessarily the number of people tested for them. So we're reporting individuals who are tested positive or negative, but some individuals get multiple tests from 2 sites. That's been something that changed. Initially, there was a swab in the nose and the throat. As that's going on, the recommendation is to use fewer specimens in just a nose swab. So there's that's one reason the numbers don't match up. There's also a lag with some turnaround time, and there's delays in reporting. So there's a lot of different labs reporting data at the same time. So we're trying to, on our DPH website, we're really trying to present accurately the number of individuals who have been evaluated and most importantly, the number of individuals who are positive or have infection, but the number of cases doesn't match up 1-to-1. Is that fair to say?
Yeah, and also due to the delay of the update once a day at 2 p.m.
That's right.
Thank you for that. And then also on ventilators, I just wanted to follow up. I understand you don't have a perfect number right now, but do you have a ballpark, considering that's something that seems like hospitals should be able to provide fairly easily? And if there was a deficiency, are there any ways you can address that?
The president has encouraged hospitals to seek and purchase more of them. We are continuing to work with our partners to get exact numbers, and we certainly can provide that when we have it.
Thank you, Matt. To Jake Ekdahl from Waukesha Freeman. Jake? A reminder again, *6 to mute and unmute your phones. Jake Ekdahl from the Waukesha Freeman. We'll move on then to Heather Poltrock from WSAW in Wausau. Heather?
Hi. Thank you for taking my call. So my question is just about the patients that have recovered. What do they need to do, or how are they declared recovered?
So I can take that. That's something that's changed over time as well. And I guess to clarify our earlier response to the question, we expect and hope that large majority of patients will fully recover, and we're not going to report everyone at some point, and we hope that comes. We hope it's minimized. We'll report deaths to COVID-19. That's something that on a national level everyone is interested in, but most people recover. The initial cases, I think, when the data about who was recovered and released from isolation was of high interest because we were still learning about the processes. So in those initial cases in the country, public health authorities were repeat testing every other day to find out precisely when the test was no longer positive. So that's not necessary to do anymore, and it's also not practical. So the criteria that I gave before to say that when symptoms have been absent, when the fever and respiratory symptoms have improved for 3 days and at least 7 days have gone by, we feel like greater than 95% of people will be recovered and not contagious at that stage. So we're trying to make a criteria that's easy to implement that is true almost all the time.
So just to clarify, so if someone is recovering at home, once 10 days have passed since their positive test, does DHS call them, or are they just deemed recovered at that point?
Local public health at this time is still following up with patients. We want to make certain that after 10 days the symptoms have actually resolved. So it's not just the time, it's also that the clinical symptoms and the illness has resolved. So when both of those things have happened, at least 7 days, and the symptoms have improved for 3 days, that's when local public health is notifying patients that they no longer need to be isolated at home.
Thank you,
Okay,
Heather.
thank you.
To Mason Dowling from WAOW in Wausau. Mason?
Hi, can you hear me?
Yes, we can.
Perfect, thank you. This question, nobody in particular, but we are interested hearing from potentially Governor Evers. What are we looking at in terms of population of those who are being treated or tested? Are we looking at maybe needing to expand places to make sure we can get all our testing done? I guess where are we at in terms of capacity across the state?
Pass that off to
Yeah, so we, as well as our partners at the state lab, have been in conversations with additional private labs to come online, as well as continuing the state lab, and they obviously can speak more if Al would like to. They're continuing to work with our hospital labs that have the capability to come online with testing. A number of them already have. More of them are coming online. We expect at least one of the big ones here in the next 4 or 5 days. But that will be a critical piece of expanding our capacity statewide to provide testing. While the state lab continues to work to get the ingredients for the cookie, as Al talked about, those reagents, other hospitals and private labs have their own suppliers, their own contracts. And so while everyone is looking to get these different ingredients for their tests, the expanding the capacity and the number of places that have pipelines and contracts will help us expand our capacity and be able to meet need. And so those are really important pieces of what needs to happen urgently over the next week to a month, and then into the coming months when manufacturers will have more prepackaged tests that will be more like annual flu tests that are easier to provide to patients.
And then my one follow-up question was, obviously this was a pretty big jump from 46 to 72 cases, and all the national agencies have been reporting that it's just going to get worse before it gets any better. My question is, with the new announcements today from Governor Evers in regards to the moratorium, everything in that, red bars and restaurants, what's the next step? I mean, how much further do we go in on this?
Well, we believe that this step will take us a long way down the road. It is about individuals responding well. It's about individuals making sure that their social distancing is part of their daily life. It's about individuals making sure that their children are taken care of, so that our child care institutions can take care of the children of emergency responders. So it's everybody pulling together on this, and if they do, we should be in a good place right now. But it is an evolving process, and we will continue to evaluate whether this is sufficient. But this is where we think we should be at this point in time. If everybody takes it seriously, that's part of the problem. I know the impact on individuals across the state obviously vary, but Wisconsinites are very resilient and very willing to step up to the plate, and that's what we're counting on.
Thank you.
You bet.
Thank you, Mason. Two reporters from the Associated Press. Will begin with Todd Richmond. Todd?
Yes, can you hear me?
Yes,
Yep.
we can.
Can you hear me?
Mm-hmm.
Hello?
Yes.
Hi.
So, Governor, hello?
Yes.
Yes.
Go ahead.
Governor, you had just said that this is an evolving process. You believe that the steps taken now will take us a long way down the road, but, what is the end game here? Are we going to continue? Because the next step would likely be shelter in place. But where do you go from here? When do you know that we turn the corner? What can you tell people, like, is there anything to hope for in the next, before August, that things will return to normal? What is your benchmark for determining, well, we've limited it to 150, 200 infections, we can start pulling back now? What is the point where you can start pulling back?
Well, I'm going to rely on the experts in this field, but at the end of the day, it is around individuals and what they're doing to make sure that social distancing is happening. And we might be asking for more in the coming days and weeks. And we appreciate what everybody's doing across the state of Wisconsin, but this is an evolving process, as you know, and people in Wisconsin now know. So as it evolves, our science will become better, and we may have other recommendations. And it's difficult right now, I'd say, to determine benchmarks, because we've seen how the virus evolves. And so I think it's very difficult to establish those benchmarks now, but I'll ask either of the experts here to see if they have any ideas on that. But, you know, we are resilient people, and I know people are waiting desperately for a final answer. But to be honest with you, I can't believe that exists at this point in time. We just need to, what we do know is that social distancing is something that works, and we're encouraging people to do it.
I would just add to that we really in public health do have a lot of tools to measure trends in disease activity, and also we in Wisconsin at DHS are not operating in isolation. We share data with all the other states through the CDC. We can do surveillance similar to our influenza programs like we did before to know to what degree is the disease circulating, how many of those cases are requiring hospitalization. So we'll collect all these data on an ongoing basis and compare them with national trends and have a clearer picture on which way this is going in the coming month. So I think we'll have a lot more information, a lot more clarity about that as we just collect the data on an ongoing basis.
Todd, did you have a follow-up?
Yes, are you there?
Yes,
Yep,
we are.
you there?
Go ahead.
So there is no goal, there is no end strategy here, just to continue day to day like this until there's no hope for if we hold this under 200 infections, we can start going back to school. There's nothing like that.
So I think, right, what we've been talking about and what people need to keep in mind and what we are keeping squarely front and center is the need to protect our healthcare system, to have the capacity to treat the folks who suffer from the most severe disease from COVID-19. And that concept of flattening the curve, as people are talking about pretty publicly, is what we are trying to do. It's why we had the declaration on Thursday. It's why we took the steps we did on Friday. It's why we're doing what we're doing today. And we will measure that stuff in real time as we move forward. But we really need the cooperation of everyone to help protect the healthcare system so that they are able to serve the people with the most severe disease. But this is going to evolve day to day as we see how this is going.
Thank you, Todd. To Scott Bauer from the Associated Press. Scott? Scott Bauer.
Hi.
Hi.
Thanks for taking the question. Governor, given this latest restriction, how can anyone feel good about holding an election where arguably a lot of high-risk people, older people will be manning the polls, and more than 10 people will certainly be congregating at polling places? Why is that still a reasonable thing to do?
Well, we continue to evaluate that, but I think I just want to make sure people understand the complexity of our spring general election. It's not a primary election. It's only a primary election for the presidential candidates. We have lots of other nonpartisan, and you know this, we have lots of other nonpartisan officials at the county level, at the state level, at the local level. And so we have to weigh all that. And, you know, to be honest with you, your point is a good one, but at what point isn't that the case? And how long do we potentially leave offices not filled because we're into July or August and we haven't held a general election? So the good news is, this, is that we have one of the easiest and best absentee ballot opportunities here in the state of Wisconsin. We have over 500,000, Wisconsinites that's already requested this. So our goal right now is to get as many absentee ballots as possible and continue to take a look at what an election would look like on April 7th. But I encourage people not to compare us to Ohio. And we obviously would not wait until the night before to make a historic decision like that. But at the end of the day, this is about the complexity of our election system. This is about our democracy. And I know it's also about health. And we will be weighing all those things going forward. But in the meantime, people should be able to get out and provide input to our democracy by voting absentee as much as people can do that.
A quick follow-up, when do you hope to have the legislature come back to take up whatever package you're going to put forward?
We'll be discussing it tomorrow with the legislative leaders.
Thank you, Scott. Andy Moore from PBS Wisconsin. Andy?
Yes, hello, thank you, can you hear?
Yes, we can.
Hello, can you hear me?
Yep.
Hello, good. This follows actually right up on what Scott was asking, and it would be for the governor. Will a certain and specific number of absentee ballots or lack of absentee ballots cause you to postpone the election?
No, it's going to be a factor of what I'm doing is encouraging people to do that so that we have lots of people voting. And I'd be doing that whether we have this situation or not. And no, there's no magic formula that exists that we'll be making that decision. It's whether we can do it safely and also whether we can have a transition of our democracy from one person to another. As you know, we have all sorts of general elections where people are retiring or not staying in office. We can't afford to let offices be empty. But in turn, we also have to be safe. So those are things that we're going to be weighing.
Okay, and then a follow-up. And this was spoken to at the top of the call, I missed it, but how will the legislature consider economic relief going forward if they can't physically convene?
We'll be talking about that with the legislative leaders tomorrow.
And this is Ryan Elsistone. To clarify, they can convene. So the ban on 10 people or more explicitly exempts the Wisconsin legislature and the Wisconsin court system.
Thank you, Andy.
Okay, good, thank you.
Mike Mullen from the Public News Service, Wisconsin News Connection. Mike? Mike Mullen? And a reminder, *6 to mute and unmute your phones. To Sandra from Spectrum News 1. Sandra? Quinn from... Excuse me. Quinn from Wheel Report. Quinn?
Stephanie Hoff from WISP Business. Stephanie Hoff.
Hi, my question is for Governor Evers. How can you meet in the legislature if there's a ban on 10 or more people when most of the legislatures are above the age of 70?
Why did it help? Did it help you have it?
So I think I understand the question in that, yes, but democracy has to continue. I understand that, and I don't know, frankly, if that number is accurate, that most of the people are 70 and above, but if we need to meet as policymakers in the state, we will meet, and it's important that we do so. So you take some chances in life, but this is one where I believe if indeed we deem that there's a necessity to meet, we will meet and do the work of the people of Wisconsin.
And then my follow-up to that is, I guess, why did you seek a repeal of the unemployment 1 week delay rather than a suspension, which is more palatable for Republican lawmakers?
Well, we'll be discussing that going forward. We need to take care of the present situation so that people have access to that.
Eric Gunn, the Wisconsin Examiner. Eric Gunn.
Yes. Regarding your reference, Governor, to the accessing Small Business Administration support, does that require a formal disaster declaration? Is that something that you plan to
I'm not sure the answer to that. We'll get that information to you, but we believe that we can access that. If it means that we have to make a declaration to do that, we'll do that.
Follow-up?
And a follow-up, with regard to the additional restrictions on gatherings and so on, is there a curfew in the offing at some point?
Not at this point in time.
Okay, Wisconsin Health News, either Sean or Tim. Wisconsin Health News, Sean or Tim?
Hi, this is Tim. Thanks so much for the time and the question. The Department of Health Services sent out a bulletin today saying that the national stockpile of personal protective equipment for healthcare workers, including respirators and surgical masks, is extremely limited. What type of request has the state made to the national stockpile, and at what point do they expect to receive some of these supplies from the federal government?
So we have received word from the federal government that we will receive a small allotment of a variety of pieces of equipment from the stockpile. The team is currently working through how we prioritize, how we work through the deployment of those of what we are receiving from the stockpile. But we and states all across the country continue to press CDC and the federal government for whatever supplies we can get. We know that there are shortages of a variety of things like PPE, and so this is going to be a problem for us. It's going to be a problem across the country, and we are very interested in getting as much as we can from the Strategic National Stockpile at the federal level. I don't know, Ryan, do you have more you want to say about that, or did we get it?
Just that we're also querying specific health systems about their needs, so we can receive requests when we have a good accounting of what resources are available and distribute them equitably.
How likely is it that Wisconsin providers could run out of these supplies?
I think there are real shortages that we're hearing about, and it's not only one type of supply. We've heard about shortages of gloves and gowns and masks and face shields, and the situation is dynamic. They're not always permanent shortages, but as we hear about health systems, particular hospitals running low on things, we try to respond as best we can, and our Office of Preparedness has communication channels to try to gather those things on an ongoing basis.
Okay, thank you.
Thank you. Three reporters from Wisconsin Public Radio. We'll begin with Shemaine Mills. Shemaine? Shemaine Mills? And a reminder, star 6 to mute and unmute.
Hi, this is Shanae. Thanks for taking my call. I'm wondering if any thought has been given to opening up schools for essential workers like healthcare workers at hospitals, clinics, and nursing homes, so that they can have childcare.
I know our Department of Children's and Families are working regularly with all folks, and in addition to our schools, to make sure that we have the facilities that we need to have, so that emergency responders and others have child care. So that's an ongoing issue. Our Department of Children and Families are working with other organizations to make sure we have enough space. But it's more than just space, obviously. If it's space, it has to be space that's been cleaned and prepared, and so it's not something that's going to happen overnight. But I know that we've made some progress in that area.
I know Minnesota has, so is Wisconsin considering potentially using schools in this manner?
Possibly.
Thank you.
Thank you, Shemaine. To Rich Kramer from Wisconsin Public Radio. Rich?
Kind of following up on a question just a little while ago, are we, in terms of testing supplies themselves, reagents and media, whatever, are we at risk of running out of those? Because at this point it's already been described as a pinch point, and with more
Well, like I stated, we're not in dire need of running out very soon, but there are issues with the supply chains. They're quite fragile right now, and that's why we want to save the reagents that we have for priority testing. As other labs come online, there are also many other manufacturers that are getting their tests up and running and approved through the FDA daily. Past couple days, there's been a couple additional ones. So it is continuing to scale up, and the more different manufacturers get their tests approved, that's additional potential tests out there.
And a quick follow-up. So, I've heard that the ramping up could take 1 to 2 months, for the full capacity of the private labs. So in the meantime, are we essentially rationing tests?
I wouldn't characterize it that way. I think we're prioritizing tests for the situations where the information delivered by the test has the highest impact. And I don't feel like we are operating in the dark in any way, because for people for whom there's a longer turnaround time, if outpatients do need, or healthcare workers, the recommendation for people, whether their test is positive or pending, remains the same, which is supportive care and isolation to avoid exposure to other people. So we have enough tests to test the most critically ill people for whom we need to know the answer immediately, and the other tests we have a longer turnaround time. So I feel like people are not suffering, the system is not suffering as a result. We're just trying to be best stewards of the resources that we have.
Thank you, Rich.
Thank you for that. And could I get the names of was it the same person that answered both times there?
This is Ryan Westergaard. I answered about the prioritization question, and Dr. Al Bateman answered about the reagents.
And Rich, those will be included when we send the video out. We'll include the names and spellings of everyone. To Bram Sable-Smith from Wisconsin Watch of Wisconsin Public Radio. Bram?
Yeah, hi there. Hi there.
Hi there.
Two quick questions. Hi. Two quick questions. The first one is, how many of our 72 cases are healthcare workers?
I believe we don't have that number available right now.
We literally just, as I was walking in, I got the numbers, and our website will update the cascade to counties. But as it relates to healthcare workers, we think that we need to protect people's privacy. There may be healthcare facilities who choose to disclose that themselves as they, if they have a case, as they work to do their own tracing and prevent the spread. But yeah, I don't know of a healthcare worker case at the moment.
Okay. And my follow-up question is, what steps are we taking or considering in order to maintain a sufficient healthcare workforce in the possibility that we see this large influx of patients due to COVID-19, and also, other considerations like the healthcare workforce getting sick and children being at home and child care challenges?
Mm-hmm. So I think this is like the heart of the issue, right? The protection of the healthcare system so that they are able to serve those who become most severely ill from COVID-19. And so whether it's the testing prioritization that you're hearing about today, that really gets at making sure that we are focusing on the tests that are most going to be helpful to protect our healthcare workers as well as those who are most severely ill, or the mitigation and social distancing strategies that you have heard about since the public health declaration was made on Thursday, are the things that are really important for us to be doing now and to be taking seriously so that we are doing what we need to do to help protect the healthcare workforce. And I think part of what you're hearing from Dr. Westergaard about mild symptoms and self-isolation, that is a big part of this. If everybody walks into a clinic, goes to a hospital, is seeking a test that has mild symptoms, and they may or may not be COVID, if they are, you are exposing healthcare providers in a way that limits our ability to protect them and to protect the system. And so I think part of this prioritization and part of this social distancing and the kinds of things we're asking people to think about and to really understand the symptoms and have a conversation with a doctor before you come in, and to take their advice as we're trying to prioritize testing and really protect our healthcare workers are critical things that we all really need to do together.
Thank you, Bren. Now to Erin Franco from NBC News. Erin? Erin from NBC.
Yes, it's Aaron from NBC News. Circling back to the election, it sounds like right now there's no consideration to pushing back the election date. Is there any consideration to suspending the in-person voting part of it? And are there any measures that might be taken, like limiting poll locations or bringing in extra poll workers? Any other changes that are being considered?
Yeah, we're considering all sorts of options, and frankly, we'll learn some tonight. We have 3 states that are moving ahead with this. We can learn from their successes and from their failures, but we do believe that having democracy move forward, and again, I have to emphasize, this isn't about the presidential primary. This is about our general election in the state of Wisconsin, where lots of local officials and county officials are being elected. And so we're taking this seriously, but we'll be looking at all the items that you mentioned, including how successful tonight's 3 states are.
Follow-up, Erin? If not, we will conclude. Our final question comes from Benita Matthews from the Green Bay Press Gazette. Benita? Green Bay Press Gazette. And *6 to mute and unmute your phone. Okay, with that, we will conclude our...
Hello, can I ask one more question, please? A follow-up?
Just one more.
Okay. Well, I mentioned it before, but it wasn't part of the answer. So regarding the Veterans Administration Hospital, is that involved in the patient care equation and also for testing? Is it involved at all in this plan?
So as part of our statewide response and the elevation of our EOC to a level 1, we are actively in conversations with the Veterans Administration here in Wisconsin, and we'll continue to figure out what sort of capacity they have to be part of our efforts going forward.
Okay. And with that, we will end today's briefing. We'll have a video of this briefing for you later on this afternoon. Any of your follow-up questions can be emailed to dhsmedia@dhs.wisconsin.gov, or you can call the media line at 608-266-1683. Also, a reminder to continue to monitor the DHS Outbreaks and Investigations page and the COVID-19 page at the dhs.wisconsin.gov site for updates on this investigation and pandemic preparations. Thank you, and have a good afternoon.